Then the hour, a CDC advisory committee unanimously voted yes on Pfizer's COVID-19 vaccine for kids ages 5 to 11. If signed by the CDC director, this recommendation could make the shot available to roughly 28 million American children.
Doctors on the panel say they are confident that the shots can help reduce the burden of the virus on kids and their families, even beyond preventing severe cases. Pfizer has shipped millions of doses across the U.S.
And thousands of them are already stockpiled here in Arkansas. Speaking ahead of today's vote, Governor Asa Hutchinson said the state is ready to roll them out.
And THV 11's Mercedes McKay has the details on what parents need to know, what shots possibly available within the next 24 hours.
We've gotten used to calling or walking into our local pharmacies throughout the vaccine rollout as soon as the announcement is made. But for some of our youngest in the state, the distribution process will look a little different at the beginning.
I wanted to advise everyone that Arkansas is well prepared to get out the vaccines and make them available for the new age group.
In anticipation of the CDC Advisory Committee's decision on Pfizer's COVID-19 vaccine for kids ages 5 to 11, Governor Asa Hutchinson says the state is ready.
We have seen an increase in cases among that age group, and so for those reasons, we want parents to seriously consider the vaccination.
The state is already stocked with 110,000 doses of the kid-sized vaccine, which Don Vinson with the Arkansas Pharmacists Association says puts us in a good position to meet the initial demand.
That's enough for a first dose for 40% of every eligible child age 5 to 11. So there's going to be plenty of vaccine. It's just a matter of getting it redistributed where it needs to be.
That distribution process will be a little different than what we've seen in the past. The first chunk of shots will be given out by ADH local health units, which are in each county throughout the state, and pediatrician offices. If approved Tuesday night, the shots would be available by Wednesday morning.
Soon after we do the initial rollout, other pharmacies and clinics that are routinely doing vaccinations will get a supply available to them.
While the initial push for parents will be at the local health units and doctors' offices, Vincent believes most pharmacies could have access to it by the end of next week to make it widely available for all kids.
Pharmacies are going to be there to fill in those gaps and provide the service all over the state, just like we have for adolescents and adults.
In Little Rock, Mercedes McKay, THV 11 News.
Mercedes, thank you. The Department of Health recommends parents make an appointment for their kids at one of the local health units as soon as the CDC makes those recommendations, which they've done now.
Yeah, and you can call the number on your screen to find the nearest health unit and make an appointment. Well, the governor and health officials are closely watching a potential uptick that emerged today. New cases came in higher than last Tuesday. 641 new infections compared to 502 a week ago. That's the first time that's happened in a couple of weeks.
And that upward bend in the curve comes as the state reported 28 new deaths. Fatalities are a lagging indicator, but as you can see by this chart, or the one that we just had up there, that average has been increasing already. The governor said many of today's reports were missing from yesterday when only 8 deaths were announced.
With kids across America on the verge of being able to get the COVID-19 vaccine, there's a new challenge now, helping them overcome their fear of needles.
An estimated 63% of children are scared of needles, just like many of their parents. But a new chatbot program named SuperMeg uses tech, science, and superheroes to help kids overcome their anxiety. Jody Thomas is a pediatric psychologist and CEO of the Meg Foundation.
Pain is not just about the needle going in the skin, it's about the anxiety. You know, kids often feel like they don't have a choice to get that poke, so as much choice as we can give them. Which arm do we want that poke in? Which toy do you want to bring? Do you want to sit on my lap?
SuperMeg guides kids through the vaccination process by teaching them breathing and distraction techniques.